much. Bienvenue. Thank you very much. Bienvenue. Good morning, good afternoon, good evening, everyone, depending where you are. Thank you for joining us for this third day of the international conference, online conference in electrification of healthcare facility in Africa. My name is Charlie Gatite. I'm from African School of Regulation as applied researcher. We had during the last 2 days a very interesting discussion on this matter of education and healthcare facility. And now we had a large number of participants from all over the world. And this is important to notice that this reflects the importance of the topic, but also reflects the interest, but also the expectation for participants on these topics. So this is the last one of the last day of the conference, and it's gonna be a last day that we have two sessions. Two sessions will be directed by my colleague Charlie Knight from Sustainable Energy for All. We will have a first session that will be a wrap-up session of the day 1 and day 2 of the conference. Then we'll have a second session that's a kind of call of action based on what we have learned during these 2 first days of the conference. What the question is, what worked? Second question to be, what can we improve, but also what we need as a comprehensive and long-term vision. So I would like to invite my colleague Charlie to guide us for the next 2 sessions. And I also thank you once again for joining us for this last day. Thank you very much. And Charlie, over to you.
Thank you very much, Charlie. Great. Well, welcome everyone. Fantastic to see you all. Great to see so many attendees joining. Yeah, just to briefly introduce myself, my name is Charlie Knight. I work for SE for All in the Powering Healthcare team as a senior energy specialist. So firstly, I'd like to thank all the participants and people who've done a great job to make the first 2 days really interesting and exciting. We've had some fantastic presentations and discussions and covered a lot of ground. So thank you to everyone who's participated so far. I'd also like to say thank you very much to today's panelists. We've got a really great mix, some really good expertise, different backgrounds and experiences. So thank you very much to all the panelists today for joining. One thing I'd like to mention before we get started in my kind of wrap up of the first 2 days is just to say that in February, the 3rd and 4th of February, that we, SE for All, we are holding an Energizing Healthcare Forum in Nairobi. So that's 2 days at the start of February. We'll be going over lots of issues that we've talked about over the last couple of days. But also there'll be different deep dive sessions into different topics around healthcare electrification and how we can push this agenda and sector forward. So if you're interested in that, we'll be inviting about 150 to 200 people. So please get in touch if you're interested to attend that. I'd also like to say that you know, if you have questions at any point during today, please pop them in the Q&A box at the bottom of your screen. You should be able to see a Q&A icon. So please pop your questions in there. There will be time at the end of this session. So we hope we get some questions from the audience and the participants. So moving on to today's session, and there are kind of 2 sessions, but they're blended into one really. So firstly, I'll give a bit of a update or an overview of what's happened for the first 2 days. I'll try and keep that relatively short because really the main event for today is the panel discussion, which should be really interesting to hear from our different panelists. So I guess, yeah, going on to what's happened in the first couple of days. And today is really the call to action, as my colleague, other Charlie said. So today is about the what and the how. I think it's about what we need to do and how we need to do that. So finding solutions to scale the sector. I think as we all know, just to set the scene a little bit, I shall go over the first panel from day one, which was about the current state of the market, but just very briefly, a couple of facts and statistics. So I think as probably most of us here know, there are globally 1 billion people who are served by health facilities that either have no electricity or have unreliable electricity. So lots of us, it's very difficult. But imagine, a woman goes to a health facility at night to give birth and there are no lights, or a health facility is trying to store vaccines or medicines but has no fridge or has no electricity for the fridge. It's a, really super important agenda, and it's something that we urgently and drastically need to address because 1 billion people is far too many. Within the sector, there's been a lot of progress, but there's still a lot of challenges. For example, there's a huge funding gap. In Africa alone, there's a funding gap of about $2.5 billion US dollars. Now, there's finance out there, but it's how we access it and how we access it in a kind of realistic and practical way to make projects more sustainable. So talking about sustainability, I'll now give a bit of a recap for the first 2 days. So we started off with a couple of presentations on day one. We were lucky enough to hear from my colleague Frederick at the African School of Regulation. And he talked about sustainable and scalable business models. There's quite a heavy reliance within this sector on CapEx funding. But how do we look to encourage and provide more energy models such as energy as a service? Because one of the big challenges is around operations and maintenance in the long term. Frederick mentioned about public and private partnerships and how that could be an option, and also how we integrate better policies and regulations to try and attract more funding and different stakeholders within the market. So how do we, provide incentives to suppliers and regulators in the private sector, for example? We could look at subsidized tariffs and other types of business models and delivery models. And then we had a presentation from my colleague at SE for All, Nicholas, who provided an overview for the Sustainable Energy Policy Hub tool. So this is an interactive platform to try and help people or policymakers develop or improve policies and regulations for energy access, and particularly around healthcare facility electrification. So how do we develop those tools? Not necessarily or how do we develop those policies? It's not necessarily an easy thing, but this tool is there to help provide guidance and information and pathways to try and improve those regulations and improve strategies and national or regional planning to help improve the sector. There's a huge amount of resources on that Energy Policy Hub tool. So if you do get the chance and you're an interested policymaker or stakeholder, have a look, because there's lots of current guidelines, policies, reports, and information within the sector, particularly around regulation policies. And then for the second half of day one, we had a panel discussion, and that was about the current state of the market within healthcare facility electrification. As I said, there are far too many people who don't have access to electricity in the health facilities that they are served. One thing that came up several times is that it's a basic human right, and no electricity provides huge challenges for healthcare services. As such, looking at different business models and connecting up health facilities is, it's not something that we can just cut off. We can't just cut off the electricity, because that would have devastating effects for the beneficiaries and the sector as a whole. So looking at some of the items within the sector, what's working and what's not working, what are the challenges and what are some of the opportunities? So to start off with, we were talking about how one good thing is that the cost of solar technology is coming down. Solar technology is improving, and the costs are becoming more reasonable. So it's not a technology challenge, but it's more a challenge around access to finance. And one of the big topics that has kept coming up for the last couple of days is sustainability and operations and maintenance. Now, we all know that health facilities are not the best payers, so it's a challenge. Who pays for ongoing operations and maintenance? If it's not the health facility or the government, who is it? So that's one of the big challenges. There is a slow movement away from the kind of heavy reliance on capital expenditure within the sector to more long-term models such as energy as a service. But how do we incentivize the private sector to become more involved? That's one of the things that we need to look at. And some of the ideas that were discussed in the first day, some really good ideas and discussions around productive uses of energy, for example. So we could use productive uses of energy alongside the health facility. So the health facility would provide the anchor load, but then provide more for the community in terms of businesses and other productive uses that could then provide revenue for the health facility or for the ongoing long-term operations and maintenance. Trying to maybe increase the number of paid services, particularly in the remote small health facilities. Most of the basic services are all free. But if we can generate some revenue one way or the other to try and cover some of these costs and create this kind of pathway for generating payment models for operations and maintenance, then that would benefit the long-term sustainability. And then it's not just about incentivizing the private sector, but also, the traditional CapEx donors. So how do we try and encourage or incentivize them to provide more than, say, 1 or 2 years of operations and maintenance? Because when we're talking about operations and maintenance, really we need to be considering at least 10 years, 10, 15 years, if not more, because it's often the 5 to 10 year period where batteries or other major components need to be replaced. And then there's, again, challenges around who pays for those. Couple of other things that were mentioned in that first panel are the climate angle. Of course, replacing diesel generators or providing renewable energy is great for reducing or mitigating carbon emissions, and also not just about carbon emissions, but thinking about climate resilience as well. Obviously, the increasing impact of climate change is having all sorts of serious effects on communities and regions. So providing renewable energy that is more reliable can help health facilities and also wider communities become more resilient to some climate impacts. Another thing that was touched on was around global coordination or coordination in general within the sector, particularly at a global level. This has seen some improvement in the last couple of years, which is great, with things like HETA and HEPA, and a lot more coordination between different stakeholders. But there's also a need for coordination at country level to keep progressing as well. For example, more collaboration between government health and energy departments to try and understand each other's needs from an energy access perspective, but also from a healthcare perspective, and how these work together. And talking about more of an integrated approach, we also talked about a more holistic approach to healthcare facility electrification. It's not just about supplying electricity, but it's about the full suite of services. So that's appliances, it could be wash, it could be staff quarters, that are all part of the more holistic aim to improve electrification for the health facilities as a whole. And then the last thing I will mention for the first day is around data. So the need for more data. There are still data gaps, in particular looking at energy assessments and audits to make better decisions on what we need to do and where we need to do this. Okay, moving on to day two. And the first session we had there was around the Multilateral Energy Compact for Health Facility Electrification. So that was set up in 2021, I think, by SE for All and Power Africa. It now has 22 partners involved in that compact. And its main aim is to electrify another 35,000 healthcare facilities by 2026. So what's the Energy Compact for this about? Well, a lot of it is about knowledge sharing and providing data and better data for the sector. There's obviously a lot of coordination and convening, so working with partners, trying to recruit more partners and signatories to be part of the compact to increase the impact and the wide-scale nature of it. And then also trying to boost implementation as well. So as I said, the extra 35,000 healthcare facilities to be electrified. So some of the benefits of this impact, as Matt very excitedly said from HETA, Matt Clark, about the human angle. So it's really about, big part of it is the coordination and the convening between partners to really bring people together, but have that human angle in terms of how we achieve these goals. We had an interesting perspective, from the private sector. We had someone from We Care Solar who was talking about the challenges of long-term sustainability, as we've mentioned, ongoing operations and maintenance and replacement for over 10 years, but also talked about some of the challenges for women in particular. So energy access, or energy poverty rather, affects women more than men. And this obviously applies to the healthcare sector as well. So they've been doing work to support women, because as they said, there are more, the majority of health facility staff are usually women. So they've been capacity building and training women to help support those staff in health facilities. And one thing that came up in this session and other sessions is that energy is an enabler. As I mentioned before, it's not just about providing electricity, but it's about providing the right services which can save lives. Again, data came up. One of the things around the Energy Compact is to provide data and share knowledge, which can really help drive decisions. Data-driven decision making can improve if we have better and more comprehensive data. And for this can be used for funding and where and when and how it can be spent more effectively and more efficiently. We then talked about some of the future targets for the Energy Compact, and quite a few of these related to data. For example, how do the indicators in the compact really impact people? Do we need to change those indicators to improve the impact? It would also be good to have more data and information about operations and maintenance, and also looking at indicators for health outcomes as well. So not just data on energy, the daily output or the number of outages, etc., but also thinking about the health outcomes and maybe the broader impact on the community. And then linked to that, and also what We Care Solar talked about in terms of capacity building, is that we need to improve the number of partnerships with local organizations, because they're the ones at the forefront of this. They're the ones with all the local knowledge, but we need to work with them to improve capacity building and increase the number of local partnerships for these initiatives. As I mentioned, there's a huge funding gap. This was also discussed in this session. So talking about different types of funding. So trying to have more of a diverse portfolio from different areas, but also thinking about committed funding from donors and also leveraged funding. So trying to leverage more funding from other different streams. And then the last point was really about private sector involvement again. So how do we incentivize them? How do we provide them with the right data? And how do we get them to become more involved in the sector to provide models like energy as a service? Okay, panel three. So that was the last panel yesterday, and that was around regulatory modifications to remove barriers and facilitate the delivery of better healthcare electrification initiatives. So we touched on quite a few challenges in this section. So obviously we talked about tax and import duties and how these can inhibit investors and private sector involvement. We looked at why regulations are, why are they not improving as maybe as much or as fast as they could to try and get more people involved. Which can, again, there can be a reluctance of the private sector to invest because of the enabling environment. We also looked at, we looked at the market and talked about some of the challenges there. So, a lot of rural, remote health facilities are not big consumers. Not to mention the fact that they are not good payers either. It makes it very challenging. And if you look at the scale of the market and how dispersed these remote and rural health facilities often are, it makes it very difficult to kind of think about it from a economies of scale point of view compared to larger commercial and industrial projects that you find that you could benefit from in the city, or larger conurbations where you have larger scale projects that are also closer together. And then also looked at some of the challenges around sometimes these facilities that do have solar PV electricity initiatives. They're sometimes undersized, so maybe lack of planning or data has not provided a contingency for services or health facilities to grow. And again, looking from an O&M perspective, some of the challenges included things around contracting. Who do you sign the contract with? The Ministry of Health or another government department? Does that mean that they will guarantee payment if there are defaults from the health facility? And also looking for the processes in terms of the practical replacement of parts. Again, who pays, but who does the work? And then looking from a regulation perspective, there's challenges around the quality of service and reliability. So how do you guarantee that the service you're providing is reliable? What are the costs? Can we look at different tariffs, cost reflective tariffs maybe to that are beneficial for health facilities, particularly in hard to reach areas. Again, going back to productive uses of energy, that's something else that we need to look at to try and increase the revenue that health facilities might be able to earn to help pay for the long-term operations and maintenance. Different ideas around lease to own, not just energy as a service, but also looking at performance-based models as well. Last couple of things I mentioned from that panel were around collaboration, in particular around resource allocation, and also with government departments and their coordination, and also contracting and tender processes that make things swift and efficient and more advantageous for private sector to become involved. And lastly, linked to that, just looking at the processes and contracting around initiatives, so where we can help with capacity building. We try and implement better services and processes for that. So that's kind of a debrief of each session. Sorry, I won't go on much longer, but just very, very briefly, I just want to kind of highlight a couple of key points or ideas and comments that came up on a regular basis. So we've got this idea that energy provision is a human right and for these health services. So really, energy is an enabler to be able to improve or provide health services that everybody needs. There was also a lot of discussion around sustainability and operations and maintenance, and how we have a more long-term strategy and framework for those. Linked to this is business models and the involvement of the private sector, who pays for the operation and maintenance, looking at subsidies or different types of tariffs and productive uses of energy. trying to generate this pathway of operations and maintenance payments, and also trying to improve the enabling environment. So, obviously looking at how to improve the regulations and policies, as well as strategies and national planning to really incentivize this sector and get more people and more funding involved. Along with that, trying to improve coordination and collaboration, which has improved quite a lot. But looking at certainly at country level, the different needs and coordination between energy and health departments and different stakeholders. And then lastly, we've had a bit of discussion around the climate angles, saving CO2, but also looking at climate resilience. Data, there are still data gaps. We need better data, more comprehensive data to help guide our decision making. And then lastly, just looking at a more holistic approach within the sector. So it's not just providing electricity, but it's really looking at the whole provision of services within the health centre and the surrounding community. So I think that's enough from me for now. So that's what happened on the first 2 days. We've covered an awful lot of ground, I feel. I've only just touched on a few things really that we discussed and presented over the last couple of days. But I'm really excited to start and kick off this last panel. It's really the culmination of what we've been doing for the last couple of days. And as the title suggests, it's a real call to action. So I'm very excited to welcome our panelists. And really the idea with this last session is, what do we need to do? What works well? But how do we actually implement these? What are the solutions? And how do we do those things to improve the sector? So I'd like to start the panel session. And to begin with, first round of questions, I'll ask individual questions for each person. So I just ask that after I've asked the question, please, if you could just introduce yourself, your name, your title, and briefly what your role is or what you're doing within the sector for your organization. So without further ado, I'd like to start off by introducing Abdullah. Are you there, Abdullah?
Hi, Charlie.
Hi, great to have you join, Abdullah. Thank you very much. As you can see, Abdullah's from UNDP, and it's great to have you here on the call. Thanks for joining us. So the question I'd like to ask you to start with is, from your perspective, what are the key improvements that you've found have happened in recent years within the health facility electrification sector? What's worked really well? It would be good to know maybe a couple of examples for solutions that have worked well within the sector that have made quite an impact. Over to you.
Thank you, Charlie. Thank you for inviting UNDP, inviting myself to this interesting discussion. I've been listening the past 2 days, and there are a lot of new ideas that we will definitely adopt into our work moving forward. I'm Abdullah Al-Kulayb, a regional specialist in the Regional Bureau for Africa in UNDP, based in New York. We've been working on solar for health for almost 7-8 years. Starting in 2017, we did electrify thousands of facilities, especially in crisis contexts, but mostly in sub-Saharan Africa and the MENA region. And really, our model was an EPC model, which we found out not to be sustainable due to many of the factors that have been raised in this call. So to jump into the question right away, Charlie, and thank you for this question. I mean, not an easy one, not too difficult, but I'll try to answer as best as I can. So since COVID has happened, we have seen HFEs being prioritized, especially electrification, given the state of infrastructure that we have seen in sub-Saharan Africa, where facilities did not have the capacity to store or distribute vaccines, as well as essential medicine. And I think that put a spotlight on that sector and has shown donors that this is a critical sector to engage with for the future, much more than I think pre-COVID. While this is not an improvement, this has led to much more brains and much more resources going into that sector, which is positive, given that the beneficiaries benefiting from it is the furthest ones behind, and also women. So this is really great that this sector has been now prioritized. We have seen increasingly both ministries of health and finance adopting a view that we need to shift to a long-term service-based model, which is a first step to be able to use the model that we will all be talking about in this conference. For this model to work without strong government ownership, it will never work. They need to be on the lead, they need to be on the driver's seat, and they need to believe in this model. So getting and building that awareness within governments in the sub-Saharan region is really key. And we find the conversations much easier than 2, 3 years ago. And this is thanks really to everybody in this, all the participants in this call, where they are really advocating for. And I'll give you an example. For example, in Sierra Leone, SE for All has done a study for the government on the service model. And now the government is very convinced that this is the way forward to electrify HFEs, which makes it easier for UNDP to come in and then try to support the government in implementing this model. So ownership has increased, and the view of this model as a long-term viable solution has also been adopted and much more understood than the past 4 years. And of course, evidence of that is adding budget lines to fund recurring service payments for electricity in health facilities, which we did not find previously. I believe previously governments saw this as a donor-only funded project, and that they did not really need to prioritize it in their budgets or resource allocations. Another one which I picked up and I think is important from an SE for All study is an increasing number, and this goes to the first point of prioritizing the sector, is that a number of governments are including HFE in their national electrification strategies or developing healthcare specific policies that prioritize this. So tariff accelerate, so for an example is the tariff regulation has been playing a critical role in scaling up the mini grid implementation for HFE. So streamlining procedures, reducing bureaucracy for obtaining the necessary permits and approval is a key component. That will help the implementation of HFE. This again links back to capacity building, especially at the government level. We're also seeing, as I mentioned before, lower income countries like Sierra Leone are willing to put money on the table from the start to help get energy service models up and running. And for this model, this needs to happen first before we could really engage governments further and raise resources from other donors. I believe the first step should be that the government is convinced, and not only convinced, but actually puts money on the table for this model and ensure that it's prioritized in their budget. And then finally, more donor organizations and DFIs as well as NGOs are starting to do serious work partnering with governments to design the de-risking tools, which is key for this model to move forward. And understanding really the investors is key for us here at this forum, because in the end, to achieve the SDGs, and one of them is electrification of healthcare facilities and providing healthcare, is, as we know, will require private sector investment in the trillions. And we need to use our limited resources that we receive from donors to catalyze multiple times the private sector investment. And this model does that. So it is key that we understand the investor, and investors look at risks. And if there is a risk that they cannot manage, they will never invest in a project. So we need to understand how they look at the risk, what are the risks they're looking for, and which are the risks that we need to mitigate for them to be able to make an investment in this sector. And these, as we know, are always the main one, I would say, in sub-Saharan Africa is payment risk from the government. Let me stop there, Charlie. Thanks.
Thank you so much, Abdallah. It's a great start. Brilliant opening for the session. So thank you very much. So just kind of to recap, I mean, interesting to hear your thoughts on EPC models. As I said, there's been quite a reliance on traditional EPC contracts and CapEx donor funding, and a phrase we heard a couple of times over the last couple of days is install and forget, which is terrible. Obviously, things are installed and then a couple of years later it breaks down and then it's forgotten, which is a real waste. And also good for the showcasing the benefits of solar energy as well. I think talking about the impact of COVID, obviously that was something that was highlighted in the State of the Market report that we published earlier in this year. There was quite a spike in not only funding but, as you say, awareness. So we need to keep that level of awareness and funding up and really make sure we make the most of that situation. I think, the coordination between governments and them leading it is really important. As you say, trying to get budget lines is very difficult. But if ultimately they're going to be the ones paying for it and leading it, it's around getting provision for budgets there. Not just kind of installing it and hoping that someone's going to take on the operations and maintenance, because if that's the plan, that we just hope it'll happen, the likelihood is that it won't. So it's really, as you say, capacity building is very important, because there's quite a perception still in some of the sector that solar energy is free. Partly because a lot of the actual capital equipment has been donated. But obviously, like many things, you still have to maintain it and look after it and use it properly to make sure that it lasts a long time. So it's around that capacity building to make sure that people understand that there are ongoing costs. Energy as a service is obviously something that's going to be growing, we hope. And I think de-risking tools are quite important. So that's something that we've been looking at in SE for All. Things like beneficial loan rates, or better long-term conditions around financing, whilst also possibly looking at other types of climate financing as well. And for example, DRECs, renewable energy credits. So thanks very much for that opening, Abdullah. That was great. So let's move on to the next question. Frederick, great to see you again. You've been busy the last couple of days, but I'd like to welcome you to the panel today. And if you would introduce yourself in a minute. The question I'd like you to look at are, what are the most significant regulations and policies that have impacted this sector recently? And similar to Abdallah, the things that have really made an impact, why have they worked so well? And are they things that we can really mobilize and work on to further scale the sector?
Thank you very much, Charlie. And good afternoon, good morning to all the participants. Very happy to see you all today. And I'm really grateful that we are having this session and for the partnership between the ASR and SE for All in putting together this conference. My name is Frederick Nyang. I'm the director of the African School of Regulation. And as you all know, at the African School of Regulation, we have a very strong focus on capacity building. We do training, we do stakeholder engagement, like what we're doing here, what we've been doing since Tuesday, yesterday, and also today. We are also involved in research, applied research in the energy sector mainly. And lastly, we also are developing a knowledge base, and all the publications that SE for All has been doing are some of the publications that you will find in our collection. So turning over to the question that you have asked about the significant regulations, I'd like to start that by saying that I have followed very keenly the discussions that have taken place since Tuesday. And some of the things that come to mind include the fact that healthcare is a human right. And looking at the unique aspects of the healthcare that we're looking at, we're basically looking at the most vulnerable communities, the hard to reach communities, the marginalized communities, and communities which largely rely on mini grids and standalone systems to provide them with energy for those healthcare facilities. And governments are involved in this, providing these healthcare facilities, but also the private sector is involved. And to a large extent, the collaboration between the governments and the private sector is very important, and even amongst government entities themselves. In fact, one of the things that has come out very strongly since Tuesday is the collaboration between the Ministry of Health and the Ministry of Energy. They have to be talking to each other. And the policies that they put in place are also very important, because it is those policies that that drive the way that the healthcare facilities will be provided with energy. And seizing on this opportunity, one of the things that becomes critical, therefore, is capacity building for government functionaries, for the ministries, capacity building for the regulators, because the role of the regulators here in providing the right regulations and the right policies for providing energy services becomes very critical. And this is one area where we as ASR are very deeply involved. We'd like to see a situation where the capacity of the government functionaries in the regulatory agencies, in the ministries, not just the Ministry of Energy, but also in the Ministry of Health, and also in the utilities that are involved in providing the energy services are taken seriously. One of the things that I've seen governments doing, and I can speak from my experience as a regulator, one-time regulator in Kenya, where the National Electrification Strategy included the electrification of healthcare facilities in hard-to-reach areas. And what the Rural Electrification Agency was doing was providing solar panels and battery storage systems for these healthcare facilities. Of course, a lot of these healthcare facilities were situated next to the administration services. And so then it became easy for the Rural Electrification Authority to provide that. But what comes through is it's very important that this is included in the National Electrification Strategy, so that it is not something that is being done in an ad hoc manner, but something that is being considered in a structured and holistic way. The other thing that needs to happen is looking at the regulatory agencies themselves. They have to consider the special needs, especially for healthcare services. Speaking from the basis of my experience as a regulator, I do remember that there would be representations from the private sector, and especially the telecom companies who would ask for special tariffs because the telecommunication services that they were providing were considered as critical and strategic infrastructure, and for which they decided that they would ask government to give them special tariffs. And essentially, this would end up with the regulators. So it's the regulators who eventually would have to make the decision on whether they would give them special tariffs or not. And of course, they would need to consult with government to ensure that that is done in a holistic manner. In the same way, the healthcare facilities should also be considered for those special tariffs. And this could include the cross subsidies, which you have mentioned from day one. It could include social tariffs. We know that healthcare facilities, like a lot of other government services, have a tough time with the payments. But it's still an issue that would need to be considered so that they could be provided with special tariffs. But again, if you look at the case of the private sector, where it is not the government providing the services, but the private sector that is providing the services, one of the things that has come out very clearly in the discussion since Tuesday is the aspect of energy as a service models. And this is a model whose time has come, and that is something that will be considered. Now, the proper incentives would then have to be given to the private sector to enable them to provide these services. Because as the previous speaker mentioned, the risks involved would have to be taken care of. And in a situation like that, it is incumbent upon the government to provide and put in place policies which would then reduce these risks or remove them altogether. So lastly, I would like to talk about the involvement of the communities in those local community, in those particular areas where the health facilities are located. And from a regulatory perspective, it's always important to engage the stakeholders to make sure that their views are taken on board. And if the regulators are then involved in speaking to these communities before the national electrification strategies are enacted, before particular regulatory practices or policies are put in place, before regulatory frameworks are enacted, they would then be able to take on board the views of these communities. And that would be of great help. So I would like to take it back to you, Charlie, and leave it at that. Thank you very much.
Thank you so much, Frederick. Really interesting to hear your perspective from a regulatory perspective. And yeah, just picking up on a couple of key points very briefly. I think, again, something that we've mentioned is very important is capacity building, not just at country and government level, but interesting to hear, that capacity building for the regulators is also very important. And as you mentioned, different types of tariffs, especially ones that can incentivize those for health facility electrification investment, and looking at subsidies as well, or subsidizing, whether that's with the community or trying to get other revenue for those health facilities. And also, yeah, I think, as you say, a really integrated approach is very important for introducing or enhancing existing planning around national electrification, strategies and policies. So anyway, I think I'll leave it there, and let's move on to our next guest. So really excited to see you here, Elizabeth. Thank you very much for joining. Please introduce yourself. And the question for you is, so talking of private sector investment, because I know that Oxford Policy Management have been working on some reports with SE4All around climate finance and finance models for health facility electrification. So it's great to have you here today. And yeah, I'd like to ask you about what you think are the most sustainable or kind of the best long-term business models that you think can help scale this sector. And why do you think those particular models have been good, if they've been tested, or why you think they would be good? So over to you. Thank you.
Thank you, Charlie. And yeah, it's great to be here today. I've really been enjoying the last few days of discussion on this topic. So I'm a principal consultant in Oxford Policy Management, which is a development policy consulting firm. I'm based in India and have been working on this topic across sort of Asia and Africa. I'm relatively newcomer to the sector, and I'm definitely coming at it from a climate change perspective, which I think is sort of will reflect some of my perspectives and comments. We, as Charlie said, we've been working with SE4All for the last couple of years, first looking at the climate finance potential, and now we're doing a study specifically looking at the resilience benefits and co-benefits that can come from the electrification of healthcare facilities and associated sort of investments. So thank you for the question, and I'm not going to attempt to sort of repeat or summarize what you and the rest of the sessions have said around business models. I think we've heard from people that know a lot more than me, actually, about particularly the promising role of the private sector under this energy as a service model. And it's clear from this conference how much learning there is currently happening on how this can work effectively. And I think even in areas where there isn't a strong local private sector ecosystem. Similarly, it's great to get this evidence emerging on what O&M costs need to be factored in and different sort of public and private models for covering this. So I guess the first point I'd like to make, which links to sort of, I think Abdullah's, one of his final points, was I think we need to broaden the finance discussion. We have a lot of learning now about business models at the facility level. But I think we need to frame it at the sort of, subnational, national level. And also consider the costs associated with developing the capacity of health facilities and public and private sector actors to design, establish and manage these projects. And even the wider investments required to the health sector generally. As we all know, there's no point in electrifying a health facility if there's no doctor there to actually make best use of that energy. So yeah, this links to the idea that maybe we need to upscale our own focus on the business model, to not just be looking at what can work for individual or small groups of facilities, but how we can create a sort of national or subnational financing plan. So in a way, the business model for the government, for all public health facilities, and still involving the private sector, as Abdullah said. And given the crucial work here of crucial role of the government, how this can be framed really as part of the government's broader financing and revenue generation plan for the health sector as a whole. My second point then links to what you introduced, Charlie, is about the potential role of the climate finance. So a report we did for SC4All looked at the scale of climate finance available and concluded it is small relative to the investment needed, but it does offer some opportunity. And I think it's first worth remembering that many of the global and regional programs that we've heard about and that are represented at this conference are benefiting from multilateral and bilateral climate financing. There's also a few, but not many, projects financed by dedicated global climate funds. And this type of climate finance is often providing the grants, often covering upfront capital costs that have been shown to make electrification projects more attractive to wider financing. But there's also some less well-known climate finance sources worth exploring. For example, sovereign green or social bonds that can help governments to raise the debt finance and get to the scale that we're looking for. So again, linking to this point about looking at this at the, say, national financing level. So Nigeria was the first country in Africa to raise $29 million to fund projects that included solar power for public health, infrastructure, including, in this case, university facilities, but could well have been public health facilities. Another opportunity is the global voluntary carbon or renewable energy markets, which also have potential, and also pick up on what you introduced, Charlie, as the DREX market, which is really interesting, and what I think everybody on the call, if they're not familiar with it, should really go and connect with them. So this certifies the generation of distributed renewable energy sources, typically up to 1 megawatts in capacity. So governments or corporations, usually in Europe or the US, that have made a commitment to decarbonize can instead purchase a credit for DRE generated elsewhere. So facilities have been receiving, around $20 to $30 per megawatt hour on a regular basis. Obviously, it's linked to a market. We looked at case studies in Uganda and Ghana that have used DREX to cover ongoing operation and maintenance costs, they've used this to mitigate currency risk of external lending. So for example, one estimated that grants and DREX financing has reduced their monthly repayments to the energy service provider, in this case by 56%. In Uganda, GSI is also combining DREX with social impact credits, which I won't go into, but they work in a similar way to DREX, but for social outcomes. And that's also provided a really valuable ongoing annual kind of source of financing. So finally, I guess my want to sum up in saying that there are clearly promising business models at the individual facility level, but we're not yet able to assess their applicability at scale. But I'm pretty positive that if we come back in 1-2 years, this will change. It's a rapidly evolving situation. And we are ready to really consider what this model should look like at a higher level. And I'd really urge this to be part of a broader discussion on health sector financing, climate financing. Thank you very much.
That's great. Thank you so much, Elizabeth. And yeah, some really good points raised there as well. I think, again, going back to the importance of government at regional, national level, looking at how they integrate the plans and looking at the finance plans, as you mentioned. And also, I think, one general point is that in terms of funding, we can't just look at one thing. Obviously, it's not, one thing is going to solve all the problems or the funding gap. So I think looking at a mix or a blend, you mentioned quite a few different things, but for example, the renewable energy credits, they're not going to provide, half of the funding gap, but what they can do is provide, regular, smallish, ongoing amounts, which can help pay for operations and maintenance in the long term. It depends on the type of carbon scheme, but, for example, quite often they go for 10 years or something. So yeah, thank you very much. Some great ideas in terms of different types of financing mechanisms and thinking about the de-risking mechanisms as well. So yeah, fantastic. So on to our next guest, Kobe. It's great to see you here. Welcome. Thank you very much for joining us. And sort of broadening or leading on from a kind of similar theme to Elizabeth is, so in terms of the enabling environment and looking particularly around how we improve regulatory regulations and policies to try and encourage or incentivize the private sector to become more involved and in particular implement, if you want to call them business models or delivery models, but looking at different types of financing mechanisms to really encourage a greater input and involvement of the private sector. Over to you. Please introduce yourself. Thank you.
Thank you, Charlie. Hello, everyone. My name is Kobe Adumopari. I am the Global Director for Business Development with Odyssey Energy Solutions, based in Edinburgh, in Scotland. So at Odyssey, we are a technology platform, and we provide solutions to governments, to donors, to private sector companies in the distributed renewable energy space. You can use Odyssey to provide for yourselves an end-to-end solution, planning your project, procuring what you need, implementing any financing mechanisms you have, and conducting, at the end, remote monitoring, impact monitoring, using live data and or third-party data. So basically, Odyssey is using digital solutions to streamline all of your processes for your distributed renewable energy space. So back to the question, by no means I am not a Frederick, who is a guru in regulations as a regulator. But speaking from a technology standpoint and the interactions we've had with private companies, with donors and government agencies across Africa, I think what I would say as a way of encouraging more private sector participation, and also how various financing mechanisms and models have been used. The lessons that we've gleaned from these things are, I believe, what would be good for me to share and also expand a little bit more. So in terms of what we are seeing in the market, both Abdullah and Elizabeth have touched on quite a number of these business models that are working and or are in the process of being developed. Practically speaking, the energy as a service models, private public-private partnerships, results-based financing schemes have been used heavily in the market to help and increase investment in health facility electrification. At Odyssey, we have been used quite extensively in both the results-based financing and also the energy as a service. It's recently been uptaken by a number of the donors. Elizabeth mentioned in Nigeria, where the government, in addition to the example she gave, implemented through its Big World Bank program, the Nigeria Electrification program, use results-based financing schemes through mini-grids and other standalone systems to electrify a number of health facilities. What this means was that we were able to incentivize through performances of connecting facilities or connecting users. Private companies are able to get incentivized to do more of these connections. And not only that, but they are able to do that sustainably. And how they do that sustainably is through, regular verifications of systems being on, or if there are issues with the systems that have been installed. So the onus has always been on developers to ensure that systems are up, they are maintaining it so that they will be able to get payment for the service they are providing. So they are paid based on, connections, and the connections have to be sustained over a certain number of months or days in the RBF scheme that was implemented in Nigeria. So in terms of the practical insights from this, I believe creating an environment where decentralized sort of engagement, as well as opening the market for private companies to garner their own sort of blended finance, in addition to any grants that will be coming through the donors and or the government, is going to be quite significant for scaling up and improving their participation in electrifying health and other public facilities in the region. In terms of the energy as a service, I think taking an example from what the World Bank SMAP is currently about to launch or implement, I think they in the past were focusing more on what Abdullah mentioned earlier, on the CapEx grants, whereby they'll provide a CapEx for the installations. But I think the lessons have been learned from that, and they are moving more towards a service delivery approach, whereby, similar to the RBF, developers and private companies will be encouraged to install and operate these systems for health facilities, and then they are paid based on the ongoing maintenance and keeping the system up and running. So this is an encouraging sort of endeavor, and what we are bringing to the table and what we have seen is that there needs to be integrity in the way that these verification of installations are made, the ongoing performance of these systems are made. And what the SMAP team and the World Bank team are really hoping to achieve here is that they create that buy-in and trust in the process within the government, because at the end of the day, we all expect the government should have trust and also the ability to continue paying for the services that private companies would be providing. At the back end of that energy as a service module, also we shouldn't forget the risks in government's ability and willingness to continue paying, which is something also Abdullah mentioned. So in this World Bank scheme, they also have the MEGA providing sort of a guarantee at the back end to support whatever grant and or whatever ongoing payments is going to be provided to the private companies. And at the backbone of all of this is the ability for a platform like Odyssey to properly investigate and query that systems have been installed, they are working, and the performances or the targets that private companies are going to be paid against are accurately measured and verified for payments to be done. I think this is something that we are currently working on, and we've tested out a few of these in systems that SMAP has put on the Odyssey platform in Liberia and in Burundi. We are hoping to share lessons and insights next year, February, at the Energizing Healthcare Forum. So hopefully we will be able to deliver more lessons on this module in February. In terms of incorporating technology as a whole in governments, I think that will be the third thing that I would say to your question, how we can improve more private sector engagement. I believe the idea of data and technology, it goes without saying that it becomes relevant when we are talking big. And when I say we are talking big, we are talking about scaling, electrifying these health facilities across the whole of the region, the whole of Africa. And these are in very remote areas, very small systems. There needs to be visibility, and there needs to be a central place where the government, the donors, and the private companies will go and see that there is a facility here. The facility is working. The facility is not working. This is, it's basic information, but it's very critical that you are able to visualize that real time, and or even over a period, able to see that there is a facility at this location. The facility is working. The facility is not working. These are first step basic information that will encourage investors to have the trust and interest in whatever solution they are being asked to put their money in as a blended sort of financing and or participate with the government and other donors. And so I think these are the three sort of bucket ideas or lessons or insights that I would say to the question you raised. Back to you, Charlie.
Great. Thank you so much, Kobe. Really, another really interesting answer. Appreciate your thoughts. And yeah, I think, that links to some of the things we've talked about and mentioned, whether it's working with government and maybe capacity building for government departments and regulators, and, how we work together with the different stakeholders. And I think that, again, data, it's really important, and it not just historical data, but up to date data, live data, which can actually help with operations and maintenance. It can help diagnose problems, and it can help provide, real-time data for implementers and regulators or suppliers about, what's working well, what's not working well, how much energy is being consumed, how much energy is not being consumed. And again, for things like renewable energy credits, that comprehensive regulatory kind of environment around verification and having robust verification processes is really important as well. So on to Stephen, last but very not least. Great to have you on the panel. Welcome. Thank you very much for joining us today. And yeah, the question I'd like to ask you is around the enabling environment, and particularly how we can maybe improve that or make adjustments to allow donors and other investors to provide longer term funding. So we've talked about operations and maintenance in particular, and sustainability. So how can we make adjustments to the sector to allow for that longer term funding and investments? Over to you. Please introduce yourself, and thank you.
Thanks, Charlie, and nice to see everyone. My name's Stephen Hunt. I lead on energy innovation for the UK Foreign, Commonwealth and Development Office, the FCDO. And in particular, I lead on a lot of the energy access related innovations, including the Transforming Energy Access T program. So I've been involved with supporting and managing the funding to powering healthcare since the beginning, and sort of tracking work across this sector for a while. I think maybe on the donor perspective, I'll maybe just start by saying I think donors are not homogenous, either between donors and also within donors. So I'm the guy who's making the case for this inside the FCDO, but maybe I can explain a little bit why it's difficult and also what would help me to make the case more effectively sometimes with my donor colleagues. I think, first of all, and what I'll do actually as well is I'll highlight how some of these have in Sierra Leone, which has already come up, have kind of enabled us to do more in Sierra Leone than we have in other countries, and how maybe there's a bit of learning from that. So first of all, I think we have to kind of really build the case for why healthcare electrification is the best use of money, or it's a priority use of money. Because at the moment, we're still suffering with it not being a top priority for the health people and budgets. They're still prioritizing doctors and nurses and medicine. Understandable, but that means it's somewhere there. And it's not a top priority for the energy people either, who are prioritizing energy access and powering the economy and keeping the lights on. So we've got this problem, and neither is it a top priority for the climate people. Because if you're chasing climate results, you're looking after the carbon. You don't go to the poor countries with the small emissions. So this is a real problem for us, and I think we need to try and kind of find a way to bring a package together which shows how there's a lot of benefits. And I know there's been different efforts at this, but the case for funding still has to be made because there's always trade-offs. And I think in Sierra Leone, I mean, very sadly, but what enabled it was Ebola. It was the Ebola crisis and the pandemic, which then really threw a very sharp light onto the need for electrification and healthcare, and strengthening. It was actually strengthening the healthcare system was the broad heading, and within that, it was powering the clinics. So I think we sort of saw that in COVID. I agree with the point I think Abdullah made, but I'm just not sure it resolved itself into a long-term shift, and that's a bit more the tricky thing. The second piece we need is a compelling model. I don't think it works to go to donors and just say, we need more and more money. An infinite amount, no, not infinite, but a very large amount of money we don't have. I think that doesn't work. We need a model which speaks to efficiency. It speaks to the possibility of costs coming down. And I think this is what Gavi is one of the best examples out there for this. So in Gavi, there was a case made for, if the donors all come together and back this mechanism, everybody will get cheaper results, and it's much more efficient and it's much more effective. And that was extraordinarily successful at raising money, but just for vaccines. I don't know if anybody from Gavi is on the line, but Gavi's, in my view, unwillingness to look at the electrification of the whole clinic and not just the vaccine fridge is still a real issue. And I'd love to see more action on that. But we need a compelling model which speaks to efficiency and reductions and the value of working together. And I think in Sierra Leone, what we got was the compelling model piece was the kind of land for power deal. So, the Ministry of Health provided the land for the mini grid power equipment in exchange for free power to then run the mini grid, which would then, the idea being, would create the revenues that keeps the service going. So that's quite an interesting model. I don't know how widely applicable it is, but that was at the core of the proposition. The land issue often being an issue. And so if you deal with land, you also had the benefit of the sort of public license to operate. Everybody benefits from the clinic, and then you have the revenue. So I think that's another one to really think about. And then the last one I want to talk about is the funding sources and cycles. So I think, again, it's not homogenous. There's different pots of funds within donors, and then within the Green Climate Fund, and then within the World Bank, and within the different places that money goes. I think, unfortunately, they all have their own cycles. I just think you have to recognize that the funding cycles of governments are not more than 5 years. they're usually less. We're having a 1 year spending period now. Many agencies have 1 year. So we have to think of solutions that kind of recognize that and not just wish it wasn't the case. I think I think capital is a big part of the cost when it comes to these things. The thing about renewables is capital is a big part of the cost. So I think in a way, I think Charlie's point about maybe if donors mainly do most of the grant upfront, and then we find other revenue sources better suited for the service provision, whether it's DREX or PREX or carbon or something else, that might be a more realistic solution. I think in the UK, we had the Private Finance Initiative was actually a go at this. It was a go at trying to kind of turn a capital into a series of future payments, but there's been a lot of issues and challenges around that as well. Indebtedness remains an issue for many countries. Future tax payments, of course, are the best source of money for this, but tax collection itself is an issue in many countries. So I think the direction of travel around trying to do the grants but linking it with the ongoing payments but from another source is probably more likely. But I think just to come back to Sierra Leone, I think we did do it mainly with grants. The integration of the private developers and the mini grids for revenue was a key bit of the sustainability story. But just the last sad, unfortunate kind of outcome really was the currency collapse in Sierra Leone, then put a huge hole in even that strategy. So every strategy has its challenges. So yeah, I'm really interested to hear the earlier reflections from the other panelists and from the rest of the session. And those are just a few thoughts to hopefully contribute to the discussion.
That's great. Thank you so much, Stephen. And yeah, it's good to hear the donor perspective as well. And as you say, we've talked about a kind of, a mix or a hybrid. And we obviously, as you said, the capital expenditure is still going to be a huge part of any of these projects. But it's finding a mechanism kind of after that, or with it, that enables the long-term sustainability. And I think looking at different types of models is obviously very important, as we've said. But I think also you emphasized a really important point around working with governments. The example in Sierra Leone was a really good one. And obviously SE4 and Powering Healthcare have done a lot of work in Sierra Leone. And it was quite a nice pathway where we started off doing the market assessment and roadmap for social infrastructure. So, not just health facilities, but also education, which is, another discussion, but nice to combine it there. And then that's obviously led to the electrification of, I can't remember the exact number now. It's about 15 or 20 hospitals in the pipeline being electrified, which is fantastic. But a key component of that is working very closely with the government. It's great relations with the government. They're very willing. They've bought into this idea of healthcare electrification, and obviously without them, none of that work would have been possible. So I think that's a really important point to bear in mind. So thank you for that. Great. So we're doing well on time. We've still got about half an hour. We do have a couple of questions in the Q&A chat, but we will leave those to the end of the session, I think. But we need to make sure we have a bit of time for that. So the next question is one that I asked to all of our panelists. And I guess please just take it in turns. We can go around the same way as we did first time round. So I'll start with Abdullah again. And, we've discussed lots of different ideas and great solutions, but the session's a call to action. So from your perspective, it would be great to hear your sort of one or two top key actions or priorities that we need to take forward to really scale up and improve healthcare facility electrification. Thank you.
Thank you, Charlie, and thank you to all the panelists. I think they were great interventions. And maybe, Stephen, who works in a donor program for the government of United Kingdom, has already answered my question, I think. in his last intervention. They know what the issues are internally, that the short timeline, which is hard to change in a country because it's linked to budget allocation, national budget allocation, national elections, whatever. So it's hard to. So what I would say is you need to align, rather than trying to change donor timelines, you need to align donor timelines to components within your project. For example, if the timeline is short, you should use it for capacity building rather than payments. And then you have funds such as the GCF and GEF that allow longer project timelines, 10 to 15 years. And maybe you should use these for payments. And then I would say the most critical one is that the biggest donor will be the host government for these facilities. So having that in place and ensuring that the host government is the first donor that places money on the table will be critical, I think, in bringing the other donors around the initiative. So the most important action to take is continue building awareness on this with the national governments, ensuring that they prioritize it, and finally ensuring that they actually lead by placing the financing in the table as a start, so to enable the other donors to be able to come in and really support this initiative. Thanks.
Thank you, Abdallah. And yeah, just to expand on that or provide an example, is where the World Bank and ESMAP are developing some work in Uganda, where they're working very closely with the government, and they will provide longer term funding, which they stagger down. So they step down each year. I think it's for 10 years to provide funding for operations and maintenance. But what they'll be doing during that period is they'll be providing funds to government departments. I think the finance department, who works with other government agencies to basically verify the operations and maintenance work, to make sure that the private sector companies who are providing those services are providing it in the right way against certain indicators, and if they meet those indicators, then they get the next tranche of the funding to pay for those services. But ultimately, it's coming from the government to the private sector service providers. So I think, that's an interesting model and similar to what you're saying, Abdullah. So
thanks, Charlie. Maybe to add one more point, I think one thing is helping government raise financing will be important also, especially from IFIs and DFIs for this initiatives. Many governments, we've realized, sometimes do not, especially the line ministries who have not engaged IFIs and DFIs, do not have the capacity to engage with them and really present a project. So it's important that not only do we support governments in identifying the budget lines, but also, if that's not enough, how do we then support them in approaching DFIs as well as IFIs to raise the resources, because their funding is much longer, right? Their loans are 10, 15 years. And so that could be used, especially concessionary loans, to fund payments. And we have been doing that work by starting with really assessments within countries. And we've done several assessments to support governments in approaching IFIs and DFIs. Mainly, we have 3 assessments that we just finalized in Mauritania, Senegal, and Cameroon, as well as assessments in Malawi, Zimbabwe, Zambia, Namibia, and Liberia. Oh.
Great, thanks very much, Abdallah. Over to you, Frederick. Maybe from a regulatory perspective, one or two key actions that you would like to see.
Thank you very much, Charlie. And I've really benefited from the discussion, listening to my fellow panelists. I've learned a lot from them. I think one of the key things that we would want to see happening, especially from the perspective of the African School of Regulation, is in capacity building and knowledge sharing. Just having this conference has brought together diverse stakeholders with a lot of knowledge, sharing their experiences, sharing their knowledge. and putting this information together so that it can benefit others who are not in this conference. That would be a great thing. And so for me, capacity building and knowledge sharing would be one of the key things that I would recommend. The other one is, of course, related to that, and it's about collaboration amongst stakeholders. Because as we've seen from here, this is not something that can be done by one party alone, but there is a great need for the stakeholders to collaborate. We have seen that as long as government ministries are working together, we get some good results. I like the example that we're given from Sierra Leone. So the other thing I would recommend is collaboration amongst the stakeholders, working together to ensure that we achieve the goals that we have set for ourselves. Thank you, Charlie.
Thank you very much, Frederick. Yeah, really, really useful and interesting. So I think I'll move straight on to Elizabeth and ask you next, what key 1 or 2 actions would you like to see being implemented in the sector?
Thank you. So firstly, the issue of research and data, and I'm aware that researchers, or like myself, that tends to be the first recommendation that we need, is we need more research, we need more data. But still, I think it is valid. And as it's been mentioned, I think that that what we need is this sort of macro level picture to show the scale of the market, to make the case, as various people have talked about. The flip side being that to get accurate data, you need facility level data. And there are very few facility surveys that have been conducted out there. And we, within OPM, do a lot with sort of government bureaus of statistics and government surveys. And there are, regular facility surveys that take place in many periodic surveys that take place within many governments of their healthcare facilities. And I think there is a sort of an easy-ish opportunity there to sort of expand the data that they're collecting to get a much better and more holistic understanding of energy supply and demand and connected issues. Usually it's a very simple one piece of information that they're collecting currently. And then another opportunity perhaps is to utilize the resources that we have within this conference. So for example, I looked at SE4's heat map, which shows that there are 20,000 facilities in Africa that they know about that have been electrified. So, and this is through mostly donor funded initiatives. So how can we use that to get a database of standardized information from at least that sample would be great, beyond the sort of a more holistic understanding from those facilities than we have currently. I think would be a good resource that people like myself and others, particularly those that are making financing cases, could use. So the second point is kind of how we can get into broader policy agendas or financing discussions. I think this has been made by a few people. So I think the sector sort of has reached a point where it's really been benefiting by being relatively simple to understand and universally wanted. So the technology is known and in general is available. I mean, not to take away from the huge complexities that I know are there, but if you compare it to other problems, for example, disease prevention, flood management, the problem and the solution is slightly more confined. But I think that a positive trend that I'm seeing now is that it's that healthcare electrification is getting part of wider debates and policy initiatives. So as I've mentioned, I've been working with SE4All on trying to get it closer into the climate change debate. And I think that's really important. And to just highlight, I think what Stephen said, about making that what we would say a climate rationale, but it could also be a healthcare rationale, and to really better kind of quantify what the climate benefits could be of this, and because it's sort of the absolute baseline of what you need to access some of these climate finance sources. But also I think because there are actual co-benefits to electrifying healthcare facilities that need to be better leveraged. So we're doing work currently about the link with resilience and disaster risks, So, extreme weather events becoming more frequent and intense due to climate change, they're regularly bringing down power grid lines. So actually, in principle, the facility solar system can provide a vital backup source of power in those instances. But actually, it has to be, off-grid or hybrid with battery storage for that to actually be effective. Also, solar systems themselves need to be designed to withstand or manage these risks. For example, adding lightning conductors or storing batteries higher up in the facility. So there are some of these solutions that, unless that you look at it within a climate change perspective, and I'm sure the same would say if you're looking at it from a healthcare perspective, you're potentially going to miss out on. So I think the message being, as the sector is maturing, I think there's more holistic consideration of the role of electrification and how it can be achieved to maximize both climate and health will become really valuable.
That's great. Thank you very much, Elizabeth. And maybe just a bit of a follow-up question from me, because you talked about, obviously, we want more data, or we want better or more comprehensive data, but that relies on, actually the data that's available or that we're able to get from, if it's little health facilities in remote areas and rural areas and, the middle of places that aren't easy to get to, for example, or have weak or poor infrastructure. So maybe just, from your research perspective, it just be good to know what your maybe some experiences from collecting data and how we can, help or support governments to improve or be able to collect more or more comprehensive data. Just maybe a couple of examples or ideas around that.
Sure. I mean, I think the carrying out national surveys of even, households or facilities, education is something that governments know how to do. They have their own sort of sources of support to do that, and the sort of bureaus of statistics is a whole separate world, really. And I think that yes, I think that the contribution that we can make is to actually enter that world and to work with those bureaus of statistics or equivalent to make a case for why they need to, because I think everybody's always asking them to collect more data. So to actually sort of help them to define exactly what is needed and making that case, and then the methodologies and the tools that they would need, and then supporting them to train their enumerators. So one not entirely related example, but in Nepal, we worked with the Bureau of Statistics to add to their existing national survey indicators related to perceptions of climate change. And so that was then rolled out as their process. So once it's sort of in the system, it is relatively easy then to roll out and to get that national level data collected.
Thank you very much, Elizabeth. Okay, great. Over to you, Kobe. And yeah, if you could just give one or two key points or actions that you would like to see within the sector, please.
Yes, thanks, Charlie. I think I cannot re-echo and overemphasize the issue Elizabeth raised in her first submission regarding data. I think from my point of view, from the technology point of view, I think we should leverage the advanced technologies we have to really expand the data-driven planning and decision-making that all the various stakeholders will be doing. I think we cannot overemphasize that, because Stephen mentioned issues with the donor coordination and what they hope to see. Abdullah also mentioned something similar, and Frederick also mentioned how the various stakeholders need to cross-tabulate and exchange ideas. I think we should use the advanced technologies we have. As if for all, we have the heat maps, which is currently powered by Odyssey. There are a number of technologies out there that we can use to collect, manage, and present the information in a meaningful way for targeted decision making, not only how to implement a project, but financial decision making, investment decision making. We should leverage the technologies we have and the direction of artificial intelligence and machine learning. We should really take advantage of that. Maybe I'll put on my donor cap. I used to be in the world of Abdullah and Stephen once upon a time. And what I can say in that regard is that not maybe a call to action, but a question that will, spur a call to action is in discussing, how to make long-term sustainability of these facility electrification. How can we balance affordability for the end user? The end user here is the government who will be paying for the service. How can we balance affordability of the end user with cost recovery for the private sector providers? On the private sector side, the most important thing to them and their investors is how to recover costs at the bare minimum. And then the most important thing is to make a profit. On the end user side, which is the government, and the past 2 days we heard that now this is sort of a social need. How are they able to afford it? And so I think a balancing act between these two key stakeholders and how we achieve that balance is going to be sort of the solution or the drag that we use to cure the long-term sustainability disease or question we've been asking ourselves. And to me, I think that is very important to find that balance. And in finding that balance, one of the things that we can see or we can do, a low-hanging fruit, is piggybacking on what Frederick said. We can do sort of a national or inter-country forum of exchanging lessons, exchanging notes, exchange programs. Countries can visit countries and learn from what they are doing, or forums, platforms like this can bring them together for them to learn from what they are doing, the lessons, the mistakes, and the insights that they get from each other can also help them make certain decisions within their context. Back to you, Charlie.
Brilliant. Thank you so much, Kobe. Very, very interesting. Okay, Stephen, over to you from a donor perspective. And as you mentioned earlier, around building the case to get funding, and maybe it's one or two key points that you would like to see the sector implement, or maybe it's one or two points or a combination of points that you would like to see organizations that approach donors for funding. Over to you.
Yeah, sure. Yeah, I've got a few ideas for this. The one that comes to my mind first is it would be great to see powering healthcare really fully integrated in Mission 300. So Mission 300 is the big push by World Bank and African Development Bank on electrification in Africa. I imagine it'll be in the picture, but this is going to be a big framework for African governments borrowing from the bank on energy. And I really hope that those governments are thinking about this, and do decide to borrow on this. And they might need the energy ministries, who will be doing most of the discussion with the finance ministries, need to have the health ministries in the conversation and be thinking about it, because it's a real missed opportunity. Now, I'm sure there's similar things on health or climate out there, but I'm working on energy, so I know about Mission 300. So I'd love to see that. I think to do that, we need advocates for this. I hope Damalola, who has a lot to do with Mission 300, will be one advocate for it. But what's Bill Gates saying about this? Ajay Banga, the World Bank president, does he know about this? Fatih Birol of the IEA has been a very effective advocate on cooking in the recent times. What are IEA saying about it? So I think advocates are really important to drive progress and some of that integration. And then last point is, I agree with the points raised about data, but I think what's as or more important is the presentation of that data. Like what's being done with it? How's it being communicated? And I think it'd be really nice to have some really clear and compelling like visuals or graphs and scoreboards, you know, showing progress. Because I think one thing is that people think maybe nothing's changing on this agenda. It's going nowhere. You know, whereas I think some countries are making some progress. So kind of bringing that out, and also, unlike perhaps access to energy for households, it's a bit more of a knowable universe of places where it needs to happen. Like, how close are we to universal? Is it more realistic? Could this be a signature issue? So I think data communication, graphs, and presentation linking with kind of sub targets and driving donor coordination, because there's a known universe of things that need to be done. You can't all do more than that. You can't do the same thing. So I think that would be a really good piece to add on top of the collection side. Thanks.
Thank you very much, Stephen. That's great. Yeah, I think you're right. With any big cause and any agenda globally, it's so important to have champions and advocates who are really championing the cause. Because if it's not on and in people's minds and at the forefront of what they're seeing, then as you mentioned before, there are so many competing priorities that it's very difficult. But it needs to be kept at the top of the agenda. I think good point. And also around data, how we present it. I think live dashboards and for example, the global heat map that we've done, making it a bit more presentable and usable for so that it's really practical for how people can actually use it, whether it's governments or private sector implementers. Now we have a couple of questions, and right, there's a couple of quite some longish questions. So I thought if the people who have asked them would like to introduce them, although actually I think only panelists can do that. Sorry. So there's one in. Just remember that. Apologies. Right, there's one in the Q&A box which I'll read out. So it's from Okudilla, and a sort of two-part question. So, bearing in mind for low-cost tariffs, is there or are there interstate policy or policies on the ground that are centered in infrastructural capacity improvement, specifically in ruthless electrification? I think maybe rural electrification of healthcare facilities in Africa. And then another question from the same person is there any customer-centered energy management model for healthcare facility management, and how sustainable is it in terms of meeting the stakeholder expectations? Would any of the panelists like to answer one or both of those? They're quite technical questions. Maybe I'll let me just paste them into the chat. I don't know if people in case people can't read them.
I could have a go at the second one, or at least some.
Yeah, please go ahead, Stephen.
I mean, I think it's worth thinking about, who is the customer, first of all. I think with the healthcare, one of the issues is it's kind of the Ministry of Health. It's kind of the health center itself. It's kind of the people who use the health center, and who is going to pay is always a challenge. I think what I've seen a few models, and I think Ignacio asked the question as well about payments for the future. So this is obviously governments can be paying. But I think what we've also seen, and probably in the Sierra Leone example I mentioned, is where you are remembering also that the clinic is part of a community, it's part of a village. And so just powering the clinic on its own may make sense, but I think I'm a big advocate for recognizing that a clinic is part of a community, and if you can turn that into a mini grid and make a whole business out of running the mini grid, then that's going to likely give you a better overall return and development return on doing that. And looking at it from, I don't know how many developers there are on the call, but from a developer perspective, it's going to be more attractive, not just to do multiple clinics that are very spread around, but to do multiple customers around the clinic with a similar equipment. So I think that it's really worth having that broader perspective. One just quick example I'm quite excited about is Mobile Power's proposition in this space, which is a kind of a containerized approach, and where they're doing the battery charging and swapping in retail from it. So it's like a distributed mini grid in some ways, where you don't have the wires, people just take the batteries. So, but it's all about the same point of trying to create some revenues to support the provision. So just a few ideas there. Hopefully those are helpful.
Yeah, thank you so much, Stephen. That's great. And yes, you mentioned Ignacio. So maybe Ignacio, you put quite a long question in the chat. Would you like to ask it in person, live? As you're a panelist, you can speak. So yeah, please go ahead.
Oh, okay. So what I was saying is that let me look at my question. That everybody agrees in the panel that energy as a service is the model, but energy as a service requires to pay the service, right? And to pay the service, we know that the health center itself will not be able to pay for the whole thing or the community if the community is poor. So we need a subsidy. And then the point is how to address the problem of getting a permanent subsidy. We know that we have permanent subsidies all over the place because the tariffs are always in every country for everybody. Either somebody is subsidizing other people or other people are being subsidized by others. Typically in a country, everybody pays the same under a certain category of customers, but urban customers are less expensive to supply than rural ones, but they pay the same. So always urban customers are subsidizing rural ones. People don't notice or don't realize that this is happening. So in the same way, health centers could be subsidized with the tariffs of other people or from a global financial system. People are discussing here, you have been talking about, we have to look at this from the governmental perspective, from a national electrification plan. Okay, the national electrification plan will have some financing that will collect some money to fill the gap between the cost of the service, the energy as a service, and what people can, or the health centers can pay, or the people can pay. So what is the way in which that could be made stable so that that is not depending on a particular governmental program, and we can attract private investors that will be paid the total cost? I think that the solution that has been implemented for electrification in different countries is to embed the subsidy in the tariff system, where it is properly obscure, but it is publicly transparent because the method is transparent. So, well, this is what I was suggesting.
Thank you, Ignacio. Would any of the panelists like to respond to that?
I could quickly, if you'd like. I mean, I'll respond to this, and I think Kobe raised a question about the profit and whatnot. I mean, the first is I mean, we're talking about subsidy, but the payments are done by government. It's not done by the communities because these are public health infrastructure, right? So the subsidy question is not integrated there because it's a public health facility. And the idea actually is to have, maybe to expand on the model, is the energy service provider provides energy to a number of facilities that make it attractive as an investment and lowers the transaction cost. So I would say a minimum of 10 to 15 million investment in solar assets in rural health facilities. And then similar to a power purchasing agreement that is signed between an independent operator and the government, this is kind of the same contract where the government will sign with the HISCO a contract for the next 10, 15 years with a predetermined kind of tariff or whatnot, and pay for that. Now, what the private sector company could do is it could actually expand because most health facilities are next to communities. It could increase its capacity of the solar asset and actually start selling its services to the community. And it could, because it has kind of a base or an anchor customer, it could sell power to the community at much less cost. So it is kind of subsidized because it has this anchor customer that will pay most all the cost plus some, and then offer this incremental, because it's not expensive, right? Incremental services to the communities. So it actually, in a way, subsidizes it because you have an anchor customer that will take the bulk of the. So it is a good model in that sense. Now, going back to whether it's cheaper for the government to do it, and I think Kobe raised it, or the private sector company. See, if you think about it, there are several advantages to this. First, if the government is to do it, it needs to put all the capex up front, and they don't have that money, right? If the private sector does it, it puts the capex up front, and the government kind of pays a predictable amount every year. So it could easily integrate it into its budget as a service, as an expense item, rather as a capex item. That's one. Number two, if the government was to do it, it needs to do operations and maintenance, and it will need to build that capacity in-house, which we have seen where they tried and failed multiple times. And the asset within 3 years is kind of degraded and not working anymore because there isn't as strong as an incentive as the private sector to keep it operational and maintained to ensure that its revenue is coming in. So the incentives are much stronger in the private sector to keep it, and that's because of the profit scheme. The fourth is efficiencies and innovations will come from the private sector, and over time, as we have seen in solar assets going down in price and solar tariffs, we're going to see the same when the private sector handles it. So I don't think it will be more expensive for the government to go through the private sector because of these reasons, and because of the other maybe non-financial reasons that the government will face if they do try to do this at their own and build their own capacity in-house. Over.
Thank you, Abdullah. I agree 100% with you.
Maybe I can add a couple if we still have time, Charlie.
Please, yeah, just if we could just kind of keep it to about a minute. But yeah, thank you for the perfect answer then, Abdullah. So, no pressure, Kobe.
Yeah, so I think to add a little bit of what is happening in the cases we are trying to implement this service module. So the government is not putting down the capex. So a donor comes in to pay about 70 or 80% of the capex, and the private company or the private provider brings the additional 20% or 30% capex to set it up. And then they install and start operating. The functionality or the role the government plays in this module is that, like Abdullah said, they agree on a fixed maybe 10, 15-year period that we're going to pay you monthly or quarterly this amount based on certain targets that you meet. So then now the push or the responsibility falls on the provider, private sector provider, to ensure that he or she meets those targets in order to be paid the amount that will cover his 20 or 30% capex plus whatever margin that they have to put on top of that over that period. Now, the question I raised, which is still, going to be a challenge, is the risks of the government being in a capacity to pay regularly that monthly or quarterly payment, assuming the private companies meet these targets that will be verified with technology and independent verification agencies. If they are able to meet all these targets, will the government be able to pay them regularly? Now, that is the question and the risks that, we need to address, we need to look at. And that is why MEGA, for example, is also stepping in to support these types of modules. Without a MEGA in place, will a private company and their investors be confident enough to enter into this type of module, that is another question. But always there is that risk of non-payment by the government, which is already in your typical mini grid or even an IPP sort of agreement with Grid Connected. And that is why they always are looking for sovereign guarantees or another form of guarantee or the other. And it's going to be the same in health facility electrification. If we don't, look at that risks in non-payments going forward. But this is how the model is being tested. And in subsequent, engagements, folks will be sharing lessons and how practical and how successful this has been. And I invite the countries that are implementing this, to share, lessons going forward, especially when it gets to the point that we have to start tracking the payments by government. I'll pause. Over to you, Charlie.
Thank you so much, Kobe. Great stuff. Okay, well, I'm just going to say thank you very quickly before I hand over to Frederick. But yeah, thank you in particular to all the panelists for a really interesting and rich discussion. Some great ideas discussed. I appreciate all your experience and comments and suggestions for ways forward to improve the sector. I think there's a lot of momentum in the sector, but I think we need to keep going. As someone said, it's important to keep that momentum going. I feel like we're on the edge or the cusp of some significant changes to improve the sector. So let's keep going. All the people here, all the donors, all the implementers, all the regulators, and the government partners. It came across really strongly that we all need to work together really well and share lots of this knowledge. So thank you for everyone who's participated in the last 3 days. I feel like we've covered a huge amount of ground. You shared a lot of knowledge, and it's been really, really interesting. On the behalf of SE for All and the Powering Healthcare team, it's been a great privilege. Thank you very much. And if you'd like to learn and interact even more, please do try and join us in February in Nairobi for the Energizing Healthcare Forum. But yeah, thank you so much, everyone. It's been absolutely fantastic. And I shall pass you over to Frederick for very last remarks. Thank you.
Thank you, Charlie. Thank you for running a very, very dynamic session. Thank you, fellow panelists, for your contributions. And to all our participants, this has been a very, very successful conference. We have enjoyed hosting you. We have enjoyed the discussions, and we have enjoyed your participation. There's a lot of information that has been shared here, and this is going to make a huge contribution to our knowledge database at the ASR. And let me also say a special thank you to Professor Ignacio for the intervention. As you all know, Professor Ignacio is the founder of the African School of Regulation, and we really have a great respect for him. So, ladies and gentlemen, thank you very much. We hope to see you again in our next conference, which we'll be organizing next year. Look out for our webinars, look out for our other activities. And those of you who wish to participate in our training, we have the power sector regulation training coming up in March. We're very happy to host you. There's some scholarships available. If you need a scholarship, please put in your application, and we'll be happy to consider this. So with those very many remarks, I would like to say that this session is closed. Have a nice day and see you next time. Bye-bye.
Thank you very much, everyone. And thank you to the African School of Regulation. It's been great working with you. Bye, everyone. Have a good afternoon, evening.